Chapter 9 continues our coverage of insurance, a thrilling topic to be sure, but a necessary one. Without it, an accident or illness can cause financial disaster. So in Chapter 9, we move to health and disability insurance. Our learning objectives. As mentioned, a major health issue can drive medical expenses to the point of forcing people into bankruptcy. There are a variety of healthcare options and breadth of coverage that you need to understand and explore before settling on a plan for you and your family. Once you find plans that fit your needs, compare them based on which features are most important to you and which are worth the cost. Evaluate the differences between private health insurance plans such as Blue Cross Blue Shield versus government programs such as Medicare, Medicaid, and plans offered through the Affordable Care Act, Obamacare. Many young people fail to recognize the importance of carrying disability insurance. Quote, "It'll never happen to me," unquote. And we'll look at what has been driving the continuing increases in health care costs. If anything has happened over the last 8 years and the advent of the Affordable Care Act, it's brought home to all of us the importance of health insurance. Healthcare costs have risen so much that even a relatively minor illness or injury can run up very high expenses. Health insurance and disability insurance is meant to ease that burden, shifting the risk from you to the insurer. On a year-to-year basis, health insurance covers annual doctor visits as well as standard wellness tests aimed at keeping you healthy. In the event of a major health issue or injury, health insurance really takes on added importance, as can disability insurance, which will pay you replacement income while you're off work. Most employed people are insured under group plans. Employers typically sponsor these plans and absorb some or most of the cost. This is by far the least costly health care. HIPAA, Health Insurance Portability and Accountability Act of 1996. This established federal portability standards so that if you change jobs, you need not lose your health insurance. Coordination of benefits means that if you have more than one insurance plan, they will coordinate paying so that no more than 100% of allowable expenses are paid. You can buy individual health care policy from a variety of companies, Blue Cross Blue Shield, but this can be very costly as you're not getting the pooling benefit of participating in a group plan of some sort. COBRA was passed in 1986. It requires employers who meet certain criteria to offer employees and their dependents the option to continue group coverage for a certain period after a layoff or if you quit. COBRA coverage is very expensive as you are bearing the full cost of the policy without any employer subsidy. However, this can be a bridge option as you leave one job and move to another. Medical coverage comes in 2 basic types, basic and major medical, or some combination of the two. Basic health insurance coverage is outlined on the slide. Hospital, room, board, and charges, surgeon's fees, physician care, and tests. This is considered bare bones coverage. Major medical is designed to cover serious injury or long-term illness. It may and will probably include a deductible. Comprehensive major medical includes a low deductible, but without a basic plan. If a policy specifies hospital indemnity, it means the insurance pays you a fixed amount for each day you're hospitalized. It does not cover expenses. It may be used as a supplement to other plans. Many group plans also offer dental coverage as an option. Group plans may also offer vision cover as an option. So-called dread disease policies pay on a very specific conditions. They're illegal in some states. Aflac cancer coverage is a major player in this area. Long-term care insurance is a relatively recent addition to the insurance landscape. Long-term care has grown in popularity as baby boomers age and life expectancy has increased. We're living longer and we need care. Long-term care pays for either in-home or nursing home care. But be aware, a nursing home or assisted living facility can easily run over $6,000 a month. General wisdom is that long-term care makes sense for those with a net worth between $100,000 and $2 million. Below $100,000, you'll be eligible for government care. Above $2 million, you can afford your own care. Eligibility for insurance and the premium you'll pay varies by age, marital status, and number of dependents covered. The age part is eliminated with an employer group policy. Insurance typically pays assigned benefits, meaning they pay the doctor or hospital and provide you a recap. Coverage frequently has a daily limit that it will pay for a hospital room. Copays for office visits are quite common, usually $10 to $15. When reviewing a policy, take a careful look at the service benefits, exactly what is, and more importantly, what is not covered and what is available as an added fee. Typically, the larger the group, the broader the coverage, and the wider variety of services provided by the policy. Benefits may have limits on hospital days or a maximum dollar limit per person. All of these factors need to be considered when choosing a policy. Cosmetic surgery is typically not covered, nor are pre-existing conditions, though this has changed with the passage of the Affordable Care Act. Is renewal of the policy guaranteed? Under what conditions can the insurer cancel your policy? Be sure you understand these provisions. If you're choosing among several policy options, here are the trade-offs you need to consider. Actual cost, reimbursement, versus specified amounts, indemnity. Internal versus aggregate limits. Deductibles, how high are they? This has gotten a lot of coverage relative to the plans available under the Affordable Care Act exchanges. Is there an out-of-pocket limit that restricts how much you have to pay? Are the allowable charges reasonable relative to the actual costs in your area? This table from the text lists what the authors consider health insurance must-haves. Basic coverage for doctor and hospital bills. Minimum 120 days hospital room and board. Minimum of $1 million lifetime max per family member. Pays at least 80% of out-of-pocket cost after deductible, with an annual deductible of $500 per person or $1,000 per family. No unreasonable exclusions. Out-of-pocket expenses per year limited to $5,000 or less, excluding vision, dental, and prescriptions. This is a useful list to check off against any plan you're considering. We need to look at and compare private health care options versus those offered by the government. Private insurers offer both individual policies and group policies through an employer. One of the largest in the United States is Blue Cross Blue Shield. Blue Cross is hospital care. Blue Shield is surgical and medical. As an example, you can buy an individual policy from Blue Cross Blue Shield, but they also run the program offered to state of Mississippi employees. Note that insurance is state regulated. Blue Cross Blue Shield of Mississippi is coordinated with, but is not the same as Blue Cross Blue Shield of Tennessee. Private health care comes in two basic plan forms, an HMO or a health maintenance organization. This is managed care. Prepaid health care. You have a primary care physician that you select from a group of specified providers. Referrals needed to visit a specialist. The focus is on prevention and wellness. It's basic with some supplemental services. The other category is a preferred provider organization, or PPO. It's more costly than an HMO. You have more providers to choose from, more choices, less restrictions. POS, or point of service plans, combine HMO and PPO plan features. Truthfully, I'm not that familiar with these plans at all. Home health care agencies have grown in both availability and popularity. Medical care provided in your home, less costly than in-hospital care. A large employer or group of employers may form their own group. Each employer group member collects premiums. Medical expenses are paid from the group's funds. There's one of these in Tennessee, TICUA, Tennessee Independent Colleges and Universities Association. There's about 35 members, including Christian Brothers University, Vanderbilt, LeMoyne-Owen, Belmont, Carson-Newman. Healthcare savings accounts work in various ways to help users save money on their medical expenses. HSA, or health spending accounts, this is money contributed to a tax-free account. HRA, or health reimbursement account, is funded solely by the employer, and unused funds are carried over year to year. Flexible spending accounts, or FSAs, are pre-tax dollars contributed by employees. The funds are managed by the employers. The funds do not roll over. They're forfeited at the end of the year. This chart from your text compares the features of these three types of health spending accounts. If available with your plan, they're worth investigating to see if using one could benefit your family. Medicare, federally funded health care for those 65 or older or disabled. At age 65, you must sign up for Medicare Part A, even if you are still covered under an approved employer-provided plan. There'll be no charge for it at this point. As you've seen in millions of TV ads, Medicare does not cover everything, making the patient liable for the difference. This gap can be a huge issue for senior citizens on fixed incomes. The four parts are Part A, which is hospital insurance. That's the one that's required at 65. Part B, medical insurance, outpatient services. Part C, Medical Advantage Plan, which we'll see on a coming slide, and Part D, Prescription Drug Coverage. Looking at each part of Medicare in a bit more depth. Part A, this is the hospital portion of Medicare. This is the part that's required at age 65 whether you're retired or not. If you do not sign up within a certain number of months around your 65th birthday, you may pay a penalty forever. It pays for inpatient care in a hospital or skilled nursing facility, and it covers some home health care and hospice. Part B covers doctor services. $183 deductible for 2017, pays 80% after the deductible is met. Part C, Medicare Advantage plans are available in many areas. They combine A and B into one plan. Part D is your prescription drug coverage. This can be a huge expense for seniors on Medicare. Medicare Choice allows having a managed care plan in addition to Medicare. The plans you see touted on TV are generally Medigap plans. They close the gap in coverage in Parts A and B, covering those charges not covered by Medicare. AARP is one of the big groups offering Medigap plans. Again, a chart from your text describing each of the plan types we've covered. Medicaid sometimes gets confused with Medicare since both are government programs. Medicaid is state-run and intended for low-income persons. You can see that it covers basic physician and hospital services, as well as skilled nursing and home care, prescription drugs, glasses, and preventive care for those under 21. The Affordable Care Act greatly expanded the Medicaid rolls in many states. Should you need more information on any of these government programs, the websites listed on this slide can be helpful. The Affordable Care Act of 2010, or Obamacare, is one of the most sweeping changes in health coverage in recent times. The slide lists some of the key provisions. Tax credits to small businesses to offer coverage. It prohibits denying coverage to children with pre-existing conditions. Temporary high-risk pool for the uninsurable. It eliminates copays for preventative care. Allows young people to remain on their parents' coverage up to their 26th birthday. Prohibits lifetime caps on coverage, and requires most to purchase insurance. The intent of the ACA was to increase the number of people covered by insurance, drive down the rapidly increasing cost of health care, and improve access to health care in the U.S. One of the most debated elements in the ACA is the provision that everyone must have health insurance, have an exemption, or pay a fine levied by the IRS. The idea behind this was that it would motivate young, healthy people to buy insurance, which would subsidize care for older folks who require more health care. The problem is it just didn't work. The premiums have turned out to be so high that many are simply paying the fine. Minimum essential coverage includes employer-provided insurance, insurance purchased through one of the exchanges, government-sponsored coverage, Medicare or Medicaid, an individual policy, and some other options. Another point of contention is the minimum essential coverage includes coverage for situations not everyone wants or needs. Exemptions from the minimum essential coverage requirement may be permitted if there are no affordable options that exist. The annual premium is more than 8% of your income. Hardship, specifically exempt groups, part of a Native American tribe, participate in a religious sect that is against insurance, participate in a healthcare sharing program, if you're currently in jail or in prison, are a U.S. citizen living abroad, you are classified as not lawfully present in the U.S., meaning illegal immigrant, bankruptcy filing within the last 6 months, eviction or foreclosure, your utilities have been cut off, substantial property damage due to natural or human-caused disaster, and the list goes on. A close relative of health insurance is disability insurance, frequently called disability income insurance because that's what it provides. Income when you cannot work due to illness or accident. Younger people tend to not consider the importance of this coverage, but an accident or serious illness can happen at any age. Disability insurance is not extremely costly and is frequently offered as part of an employer-provided insurance program. Short-term disability insurance usually provides benefits within a short period of filing, which can continue for up to a year. Long-term disability is meant to provide income for someone who is not expected to be able to work for a lengthy period, over a year. There are several sources for disability income. Workman's compensation pays if your injury or illness comes from your job. Most employer insurance programs offer short-term and long-term disability insurance at low rates. For disabilities expected to last over a year, you may be eligible for Social Security benefits. Private disability insurance is also available to supplement other sources. These usually pay somewhere between 40 and 60% of your pre-disability income. So what do you need to look for in a disability insurance policy? Exactly how does the policy define disability? What is the waiting or elimination period? Benefits do not start immediately, usually in 1 to 6 months. The shorter the waiting period, the more costly the policy. How long will the policy pay benefits? A specified number of years, until you reach age 65, for life? What percentage of your income will it replace? Greater payout, greater cost. Does the policy pay only for accidents or accidents and illness? Is the policy automatically renewable? Exhibit 9.5 in your text gives you a table to figure out how much income you could receive from all sources should you become disabled and unable to work. If something does happen, will you have enough income? Our final topic looks at the rising cost of health care. The U.S. has the highest per capita health care cost in the world, but we also enjoy excellent health care. Costs have been increasing and are expected to grow at 5.8% annually through 2022. It's a pretty staggering number. One factor contributing to these costs are high administrative costs involved in health care, estimated at 26%. Besides admin costs, what's driving these increases? Technology has become very sophisticated and expensive. The elderly are living longer and requiring more health care for longer periods. Regulations, lots of them, have certainly contributed to the rising cost and the high administrative expenses. You can see the list. And then there's always fraud, waste, and abuse. So what's being done about it? There's been a rise in community health care programs aimed at encouraging preventive care and general health education. You could pay cash. Not something we see a lot of anymore, but if your doctor doesn't have to deal with an insurance company filing, you may just get a discount. What can you do to reduce your health care cost? Well, you can take care of yourself. Eat a balanced diet. Keep your weight under control. I am sorry to say that Mississippi is one of, if not the most obese state in the U.S. This is not an honor we wanted to win. Unfortunately, being overweight can drive or aggravate other medical problems: heart disease, diabetes, high blood pressure. Avoid smoking. If you smoke, stop. Many insurance programs cover smoking cessation programs. Don't drink excessively. Everything in moderation. Get sufficient rest, relaxation, and exercise. A serious exercise program is great, but just walking more would help. Park further away from the store and walk. You won't freeze and you won't melt. Get a Fitbit-type device and track your steps to motivate you. Drive carefully. Protect yourself from medical ID theft. This is just another form of identity theft that targets your medical records as a resource of ID data. We're to the summary. I'll scroll through them for review without comment. In the Connect problems, pay particular attention to problems 6 through 8. Types of health insurance. Major provisions of a healthcare policy. The trade-offs. Private healthcare plans. Healthcare accounts, government programs, and Obamacare. And disability insurance. Drivers of the high cost in healthcare.